In the healthcare profession, the cultural diversity of a multicultural society can be as much a hindrance as a challenge, especially in areas that are predominantly one culture or another, one race or another. Disparity in all its forms can run rampant. According to the Agency for Healthcare Research and Quality, roughly 30% of Hispanic and 20% of African Americans lack a regular source of health care, as opposed to the less than 16% of whites. These same minorities are far more likely to rely on hospitals and clinics for said health care than Caucasians. To be clear, when I say disparity, I refer to the massive differences between races and ethnicities, and the unbridgeable gap they can sometimes cause. To bridge that space, many larger healthcare organizations opt to create centers of excellence in order to train and maintain their professionals in ways to increase cultural competence when dealing with patients. To properly address ethnic disparity in healthcare, we must first identify the problem, review our options, and move forward based on the long-term effects of others' efforts. When we think of ethnic disparity, we don't often think of a doctor's office. After all, most physicians are very friendly, or professional, or both. This kind of behavior does not make someone think that they are being discriminated against. According to the American Medical Association's recorded statistics in 2008, more than half of all physicians are white. As is likely, most doctors are from the middle to upper class as well. With the vast diversity of our society, this can create an environment that readily brews ethnic disparity. Much of the disparities in a healthcare setting can be attributed less to a person's race and more to their lack of health insurance, but that is something of a higher likelihood in Hispanic and African Americans. Additionally, minorities are more likely to avoid healthcare situations for any number of personal reasons, resulting in an overall feeling of discontent in a medical setting. Healthcare professionals, whether administrative or those that have direct contact with patients, should learn to be aware of their own behavior and identify disparities around them. Directly related to identifying disparity in the workplace is trying to fix them. It can be assumed that once a physician realizes he is reacting to the differing cultures around him in a negative way, he will begin to adjust his behavior accordingly. However, not all that discriminate know that they are doing so, and it is up to the physician in charge of the practice or clinic to realize what is happening and to take action. Healthcare organizations often have different options to increase the awareness of ethnic disparity and the level of cultural competence in their employees. In some instances, it can be as small as a seminar on cultural competence and how to eliminate disparity in healthcare. Another, more specific way to address this issue is through the use of a diversity consultant, something that is much like what it sounds. A person or team of people hired to train professionals in cultural competency in order to minimize disparity in the workplace. Lastly, there is the option that many larger healthcare organizations are more inclined to use, centers of excellence. When I refer to a center of excellence, it most generally means a facility or organization that creates healthcare value above the average in a specific location. In fact, many people have seen a center of excellence in a hospital. It is most often a department within the organization that concentrates on certain healthcare values, creating and using different methods to increase quality of service and care. Sometimes you might find a hospital that consists of several centers of excellence, such as the St. Edward's Mercy Medical Center in Fort Smith, Arkansas, which consists of a heart center, a cancer center, a women's center, and a center of excellence for administrative purposes. While not always created to improve relations between healthcare professionals and the patients they treat, these centers are always put into place to create a large improvement in at least one aspect of healthcare. Furthermore, it should be understood that a center of excellence is created to be the most attractive thing in a healthcare organization. As to be denoted as such, they must generate expert care and be cost efficient, as well as producing the best results. To fully persuade one over to the idea of centers of excellence, perhaps I should clearly illustrate their benefits. Organizations with centers of excellence are more sought after and usually have a higher quality of care, in which improved safety standards and patient awareness should be a given. In addition to increased competence when dealing with the diverse backgrounds of patients, these centers also create a more organized approach to healthcare, making them highly cost-effective and resulting in lower procedural costs. Lastly, organizations with a Center of Excellence usually have a higher level of accreditation, something that is very important to those in the healthcare profession. Though the accreditation of a healthcare facility may seem like something only someone in that particular profession would fully comprehend, it can be understood in layman's terms as passing certification protocol repeatedly and consistently with an eye toward quality and safety. With a dilemma like racial and ethnic disparity in healthcare, identifying the core problem, finding options, and resolving that difficulty through a single decision, complex though it may be, is often the right path to follow. Finding the proper solution for a particular organization, whether it is a group practice or a large hospital, is a very important part of addressing difficulties in healthcare. Completely resolving ethnic disparity between employees and patients may be a long time coming. In fact, we may never achieve perfect cultural competence. However, as with any other difficulty we face, we must try in order to make a difference.